If you're dealing with pain or swelling in your gums, or you spit blood after brushing or flossing, your body may be telling you that something's not quite right. Bleeding from any part of your body suggests an injury, and bleeding gums aren't an exception. Swollen, inflamed gums are a sign that bacteria are infecting your gums. To prevent further damage to your gums, teeth, and jaw, there are plenty of home remedies you can use to help prevent gum disease until you see a dentist. But first, let's look at exactly what causes gum disease in the first place. Gum disease begins when plaque builds up on your teeth and around your gums. Plaque is a sticky film containing bacteria, toxins, and food compounds. Your body responds with an inflammatory response from the immune system. This response leads to bleeding gums, known as gingivitis, the earliest sign of gum disease. As chronic inflammation continues, the bones in your mouth may deteriorate and lead to tooth loss. Gum disease is the leading cause of tooth loss in adults, and 47% of people over age 30 have gum disease, which is pretty shocking. If you want to treat or avoid gum disease at home, here's what you can do. 1. Warm and cold compresses. An effective and easy way to relieve painful gums is to apply a compress on your gums to relieve your pain. Either hot or cold compresses will do. For a hot compress, heat up some water, but make sure you don't bring it up to a boil. The water should be hot enough for you to tolerate it. Take a clean cloth and soak it in the water. Squeeze off the excess water and place it on your face in the area of the gum pain. For a cold compress, an ice pack wrapped in a clean cloth and applied the same way as a hot compress. You can alternate the use of both compresses until the pain and swelling go down. 2. Saltwater rinses. Saltwater rinses are a great home remedy to help soothe painful gums. The salt in the water prevents the growth of bacteria and helps get rid of what's already growing in your mouth. Start by warming a cup of water, make sure it's not boiling, and add 1 teaspoon of salt to it. Swish the salt water in your mouth and rinse well for a few seconds, then spit it out into the sink. Make sure you don't swallow the water. Rinse your mouth with salt water at least twice a day. 3. Hydrogen peroxide. Hydrogen peroxide helps you soothe the pain of gum disease and reduce gum inflammation. It's also a great agent to kill germs and fight many other oral problems. To start, mix equal parts of water and hydrogen peroxide. Swish the peroxide solution in your mouth for about 20 seconds. Spit in the sink and rinse your mouth out with warm water. Another way to use hydrogen peroxide is to make a paste using baking soda. Apply the paste to your mouth, wait for 2 minutes, and then rinse off. 4. Tea bags. Tea bags are a great way to soothe painful gums. Soak a tea bag in boiling water for at least 5 minutes, as if you were to make tea. Let the tea bag cool off for a few minutes so it's not burning hot and apply it to the affected area. Not any tea will do here. Try to pick a tea that has astringent properties such as green tea, black tea, or hibiscus tea. You can also pick a tea that is rich in anti-inflammatory properties such as chamomile and ginger. 5. Tea tree oil. Tea tree oil is known for its natural anti-inflammatory and antibiotic properties. It's perfect to help with your painful gums and other oral ailments. To use, add a few drops of tea tree oil to a glass of water and use it as a regular mouthwash. You can also buy a toothpaste that contains tea tree oil for a little extra help. 6. Turmeric paste. Turmeric is another natural ingredient that contains antioxidant and anti-inflammatory properties. Turmeric helps reduce the swelling, pain, and inflammation of your gums. You will need to make a paste using a 1/4 teaspoon of turmeric and mix it with a little water until you make a paste. Apply on your affected gums and leave it for 5 minutes. Make sure you rub it on your gums using gentle massage motions. After 5 minutes, rinse the turmeric residue with warm water. Repeat the process every day for 1 to 2 weeks or until the pain is gone. 7. Over-the-counter painkillers. If the pain is getting in your way, it may be best to opt for instant pain relief. Some over-the-counter pain relievers will do the trick. You can try pain relievers such as aspirin, which are available at a majority of health stores and pharmacies. For more effectiveness, you can combine the painkillers with other home treatments. Of course, painkillers will only mask the pain, so be sure to work on getting rid of the problem so that the pain is no longer there when your medication wears off. 8. Oral anesthetic gels. You can also use oral anesthetic gels you can get over the counter to help you with your gum pain. These gels combine natural and synthetic ingredients to help numb your gums and bring you pain relief. Again, these can only be used on a short-term basis, so they're definitely not the answer for treating your symptoms. 9. Homemade dental spray. You can make your own dental spray to help relieve your gum pain by using essential oils as your main ingredient. Use a new and clean spray bottle that hasn't had another product inside it, and add clean water to it. You will need about 5 drops of the essential oils of your choosing. Great oils to use are oregano, peppermint, and clove. These oils have pain relief and anti-inflammatory properties. Spray the solution directly onto your gums daily until your condition improves. 10. Improve your nutrition. A great way to prevent and improve gum disease is to improve your nutrition. Start by incorporating calcium, vitamin C, and folic acid into your diet. Not having these vitamins in your diet could be one of the culprits of swollen gums. Vitamin C can be found in a variety of foods such as broccoli, bell peppers, oranges, pineapples, kale, kiwi, and strawberries. Getting the right amount of calcium can bring many benefits for your overall oral health. Calcium is found in dairy, soy milk, tofu, sardines, cereals, and collard greens. Add folic acid to your diet by eating beans, lentils, broccoli, asparagus, green peas, and avocados. 11. Drink green tea. Green tea contains high amounts of antioxidants that may help reduce inflammation. It can help counteract the immune system's inflammatory response to bacteria in the mouth. This reduced inflammation helps reduce damage to the gums and supporting jawbone. The polyphenols in green tea can also restrict the growth of bacteria that lead to gum inflammation. Drinking green tea may help overall health, and it's an alternative to coffee that many people enjoy. Consider adding a couple of servings every day to your diet, but be careful if you're sensitive to caffeine. 12. Use aloe vera. Aloe vera has a long history of treating scrapes and burns on the skin, but it's proven to be useful in the mouth too. Research has shown that aloe vera is just as effective as 2 commercial toothpastes at reducing disease-causing bacteria. Aloe vera has also been shown to help healing after gum surgery. Application with gel can result in better initial healing and reduced discomfort. If your gums are sore or swollen, you'll probably get relief with aloe vera. If you're using an aloe rinse, swish for 30 seconds, brush, and spit. You may also directly apply an aloe vera gel and gently massage it around your gums. 13. Make sage mouthwash. Some types of mouthwash contain high amounts of alcohol and may even dry the mouth out and allow more bacterial plaque to form. But a rinse that contains sage can calm inflamed gums. Daily rinsing with a sage mouthwash can decrease the bacteria that causes dental plaque. You can make your own sage rinse at home. Add 2 tablespoons of fresh sage or 1 teaspoon of dried sage to a cup or 2 of boiling water. Let it simmer on low for about 10 minutes before straining it. You can store it in a bottle and rinse with a small amount twice daily for 30 seconds. 14. Use lemongrass oil. A mouthwash containing a small amount of lemongrass oil can lower bacterial plaque levels. One study actually found that a wash with 0.25% of lemongrass oil can reduce plaque better than a proven antibacterial rinse used to treat gum inflammation. A lemongrass oil rinse is quick and easy to create, but it can be pretty strong. Simply add 2 to 3 drops of lemongrass oil to a cup of water, swish for 30 seconds, and spit. You may want to try just 1 drop at first and increase if it doesn't aggravate the lining of your mouth. 15. Stock up on berries. Scientists have found that nutrients in cranberries and blueberries can be highly effective in protecting teeth against a strand of bacteria responsible for accelerating tooth decay. These natural compounds, known as polyphenols, help fend off harmful bacteria in the mouth, which reduces tooth decay, plaque, and gum disease. Cranberries seem especially good for our oral health as their polyphenols stick around in our saliva and will continue to help our mouth even after we've swallowed them. What is especially exciting is that natural cranberry extracts are completely sugar-free, which means they can be added to oral care products like healthy drinks, mouthwash, and toothpaste. Keep in mind that though dark-colored berries offer a good supply of water and fiber as well as other nutrients, the fruits themselves may also contain high amounts of natural sugar. So if you're eating them as they are, keep in mind that you need to be mindful of your intake. 16. Don't forget to brush. And finally, brushing your teeth twice a day and flossing is still one of the best home remedies for good oral health. Removing plaque and disrupting bacteria that colonize the teeth and gums removes the primary cause of gum disease. Bacteria quickly reproduces in the mouth, so it's important to make morning and night cleansing a consistent effort. There's no point in using any of these gum disease remedies if you don't brush and floss every day. Simple home remedies such as saltwater rinses, cold compresses, turmeric paste, tea tree oil, amongst other things, can help you soothe gum pain. Don't forget, of course, to have a good oral health care and to treat the first signs of gum inflammation. The sooner you discover problems in your mouth, the easier it will be to treat them. In all cases, you should visit your dentist if you think you might have gum disease. They'll provide you with the right dental care to help keep your teeth as healthy as possible. I hope you've enjoyed this video. If you have, please subscribe to this YouTube channel. And don't forget to give this video the thumbs up. And I'm sure you're going to enjoy this next video on how to reverse receding gums naturally. Thanks for watching, and bye for now.